what really drew me to Brad and Amy was the program that they had that could draw all healthcare professionals in the same room because they have a common message. The common message is, how can you prevent diabetes, heart attack, and stroke? And the central thread that goes through that affects every healthcare professional, and that message is inflammation. And any healthcare professional today understands that inflammation creates risk that is maybe even distant from the source. What Brad and Amy bring to the dental profession is that by tying in the clinical laboratory tests that they train all clinicians on, and by tying in the tests that are now available through salivary diagnostics, is it ties in the message, and that is that everything matters. We just have to know what matters and be able to measure that. So their methodology and the methodology that I've used through salivary diagnostics helps us determine who's at risk, whether they have diabetes, heart attack, or stroke experience, or whether they're headed that way, and thus creates a line of communication between the physician and the dentist and the patient, and then it triages the management of that patient for the patient's well-being. Again, as a dentist, our experience is to know the primary risk factors that are associated with that, but not the treatment of heart attack, stroke, and diabetes. Having said that, the message that Brad and Amy bring is that all healthcare professionals should know more about how physicians are treating their patients. By doing so, then of course we help co-manage the patient, and the patient's safety is known by all that are involved in the care of that patient. The field of oral medicine is certainly aware of two biomarkers and are giving a lot of attention to those, HbA1c and also CRP. Those are big biomarkers that are being looked at in the dental and discussed a lot in the dental community. But what Brad and Amy bring to us is that those biomarkers are not the only biomarkers that we need to be looking at. So by bringing in the expertise of this model, it helps the dental professional know that there's much more to inflammation and risk than just those two tests. The current standard of care has a tendency to wait too long because the risk assessment model does not always prevent diabetes, heart attack, and stroke. The model that Brad and Amy have created is that treat early disease prior to the event, and therefore by understanding who is at risk and by treating the risk to reduce the risk, then the possibility is to prevent anyone from ever having diabetes, heart attack, or stroke. Once we have already experienced those events, the really nice thing is that while we could have prevented that, we can also help reverse that through the philosophy and through the treatment modality that Brad and Amy present. The dental clinician or the medical clinician will start looking closer at risk. And thus, from a dental perspective, we'll start looking at clinical laboratory reports that we can request from our physician, and we can create a line of communication to help determine long before that patient is at risk in our practice. And by sharing that kind of information, of course, the ultimate goal is to protect the patient while they're there, but also to help in that role of the prevention of diabetes, heart attack, stroke. The message that I bring to my colleagues in regards to coming to these preceptorship programs is that it will be one of the key events that will change your life. Number one, you'll understand the risk for you and for your family, and so you will realize that perhaps you are not receiving optimal care. And then secondly, and so you're important. You, the clinician, are important. So it's important that we protect you. And Brad and Amy are concerned about you or me as they are their own patients. The message then that we can take back to our colleagues is that it will help you perceive how you see your patient from day one. You're already taking a medical history on your patient. Now you'll understand how to use that information. What I think that needs to happen is for the public to be aware of the impact that the Bale-Doneen method can have on their health. I believe that the public can drive the model once they realize that they don't have to wait till disease happens. So perhaps the best way to get the message out is through some kind of media. Certainly these kinds of programs teach clinicians, but as we've learned from the TV ads that are available today, such as Lipitor and so forth, when we have patients come to see us asking for tests or asking for treatment, then that's the ideal model, because that'll drive this model. Well, the value of this model for the caregiver is that you are giving your very best knowledge to the care of the patient. That's the ultimate reason that all caregivers go into any caregiving profession, is that they care about people. And when you know that you're giving your best, you sleep well at night. And so from that standpoint, I'd say that is the key message. And when you sleep well at night, then that's the best you can ask for. The science has been saying for almost 2 decades now that chronic inflammation is a major player in all of these 3 serious diseases: diabetes, heart disease, and stroke, which are, of course, the largest killers and the largest life takers from families in America today. And what Brad and Amy are bringing to the profession is a theme around the common message of inflammation that everybody can understand and everyone can be involved in.